Well, hello, everybody out there in real world, and welcome to King County Recovery Coalition podcast. My name is Brad Finegood. I am a board member of both King County Recovery Coalition and the Washington Recovery Alliance. It's such an honor to be here with you all today, and thanks for tuning in. Just in full disclosure, this is fanboy moment for me because our guest today, the community's conversation today is with just an amazingly special person, Esther Lucero. Esther is, I'm going to say this and hopefully I get it right. Yeah. And then if I don't, please feel free to correct me, is the CEO of Seattle Indian Health Board. And with that, I'm going to kindly ask Esther to introduce yourself and maybe say a little bit about yourself and the health board.
Absolutely. So, Yate, King County, how are you? My name is Esther Lucero, and I'm Navajo on my mom's side, Latina on my dad's side. And yes, I serve as the president and CEO for the Seattle Indian Health Board. I'm in my 9th year of service with the Seattle Indian Health Board. And for folks who don't know about the Seattle Indian Health Board, we are a federally qualified health center, which means that we see all people regardless of their ability to pay. So we're part of the safety net. And we're deemed an urban Indian health organization through statute. So that means that we're part of the Indian Health Service system. And we serve American Indians, Alaska Natives when they live in cities. And so we always say that we serve all people, and we serve all people in the Native way. The other thing we do is we operate the Urban Indian Health Institute, which is one of 12 tribal epidemiology centers in the nation, and the only one that has a national scope. And soon to return is our Thunderbird Treatment Center, which will expand from 65 beds to now 92 beds, with 15 beds dedicated to serving pregnant and parenting people. Wow.
Amazing the work that the Seattle Indian Health Board does. Will you tell me, so many things to pick apart in what you just said, not to pick apart, but to expound upon. So the epidemiology work, the work around data fascinates me.
You're kind of a data nerd.
I'm just kind of like a nerd like that all around. It does, because I think there's such a story to be told in information, right? And data. And I know we didn't plan on talking about this, but can you tell me why that's important?
Oh, I think it's incredibly important. Yeah. So first I'll tell you that our Tribal Epidemiology Center is deemed a public health authority.
Amazing.
I think a lot of folks don't really understand that, right? So we have the same access to data, or we should have the same access to data that the county does or the state does. Yeah. I have to tell you that we're constantly fighting for that right. That was actually permanently reauthorized through the Affordable Care Act. I get to work with an incredible partner, Abigail Echohawk, who is our executive vice president, and she leads all of our public health work. We are really uniquely positioned to have that data center because, Abigail really championed, coining the term decolonizing data. And what that means is that we tell our stories by us and for us. Yeah. And I'll give you an example related to, recovery, sobriety. Yeah. A lot of folks, just in general population will assume that American Indians, Alaska Natives have high rates of alcoholism, which is true. Uh-huh. And it's also true that our youth have the highest rates of abstinence. And so when you tell that entire story, right, then you can really tap into the things that are beneficial for our communities as well, our strengths as well as our opportunities.
Yeah, and I can imagine when working with non-native groups who are working with data sets, just not having the insight and the knowledge and the personal experience and the life experience to be able to tell to be able to understand the story, to be able to tell the story.
Sure. I think that data is one of those ways. I think about it as more like paper genocide, if you will.
Yeah.
Because, if we don't have the data, we often hear from legislators, oh, well, that's a nice story.
Yeah.
but prove it to us, right?
Yeah, totally.
And so by having these tribal epidemiology centers who actually have the skills to scrub the data in a way that make sure that our people do not become invisible, right? Sometimes it's shifting the conversation to prevalence, right? From like overall numbers, like those types of things are really key to systems change.
Yeah, no, I totally. There's so many layers to that.
Yeah.
I also so recovery you mentioned and the recovery community. So when we were thinking about folks who impact the recovery community and being able to talk to folks and being able to have conversations with folks so that folks in the recovery community can get to know and to understand and to love the work. You were, the first person I thought of. So this past year, just to Esther's horn a little bit, you won the King County Recovery Champion Award.
Sure. Just trying to follow in your footsteps, Brad. I think that you won it the year before, right? I think it's so funny to see you kind of geek out and try to give me a platform to talk about data. But the reality is you have done that data work in King County, and I'm so grateful. The reason that we have respect for one another is because you completely understood what it meant to make Native people invisible and how for, centuries we've made Native people invisible in data, and you championed that in King County. And I know that was one of the small reasons that you won that award as well. So I just want to say thank you for that. And thank you for always being a really incredible partner and champion. And yeah, I have to tell you, I was floored by that. I was really taken aback. I think that, I was called to this work in a way, I never sought out to be a CEO.
Yeah.
Quite frankly, I never sought out to move to Seattle. In fact, my wife and I had just completed our house renovation in Oakland, and I got this call. And we uprooted our entire lives to come here. And I remember thinking, wow, this is an incredible opportunity, and I recognize the importance of the role. And when I got to speak with our community and elders, because I basically just started listening the moment I got here, elders clearly said to me, "Oh, you think that you're the visionary? You think that you're the leader? We called you here. We prayed you here. We had this vision long before you were even alive, and you are here to bring this vision to fruition." And they followed it up by saying, "And you need to behave that way." And so I think about that all the time. So when you receive accolades, Recovery Champion Award, I just think about it as just being in service, and hopefully what that means is that I'm actually meeting the expectations of our community, and that I'm just using whatever gifts that I have to offer, because we all have gifts, right? To stand in that circle with community to make a difference.
Yeah, that's so amazing. And you've done so much amazing work since you've been here. In my humbly objective opinion, and we're so deserving of such that small accolade. Can you maybe talk a little bit about the work that has happened that the health board has done to promote recovery and recovery oriented systems of care since you've been there, and maybe even beforehand, which I know that there's been so many layers to it, right?
Sure.
Can you talk a little bit about the recovery work that's happened at Seattle Indian Health Board?
Absolutely. I think first you have to understand, when I joined the Seattle Indian Health Board, the Health Board had already been in existence for 45 years. Right. And it was folks like Joanne Kaufman who really championed the establishment of Thunderbird Treatment Center, the first one. Yeah. It was folks like Ralph Forcara who established the Urban Indian Health Institute, right, our tribal epidemiology center. And we're talking about great leaders before that, Bernie Whitebear, Luana Reyes, just incredible people. Yeah. I think that when I arrived, I wanted to take a look at our strengths. Yeah. And I wanted to make sure that we were going to be here for the next 45 years, the next, multiple generations. Yeah. And so I wanted to make sure that we built upon that. So, for example, we had one clinic when I arrived here. Uh-huh. Now we have 4 clinics. Amazing. And we're hoping to add a clinic to our new Thunderbird Treatment Center as well. So that will take us to 5. Uh-huh. The other thing with Thunderbird Treatment Center Center. It was an incredible program. And quite frankly, we've always had a culturally centered approach to recovery, which we're really proud of. And quite frankly, it had some of the best recidivism rates in the state. And we were in a terrible building.
Yeah.
We were in an absolute terrible building.
Yeah.
I mean, just getting money to renovate that building was incredibly difficult.
Yep.
So I wanted to make sure that I fulfilled that commitment to our community.
Yeah.
I have always said, I want the Betty Ford of Indian country. Like our people deserve the absolute best.
Absolutely.
I was thinking about like if you and I went into a recovery, right? We'd be in like Tahiti somewhere or like Malibu or wherever they have these incredible recovery centers. Our people deserve that too.
Yeah, absolutely.
So here we are having incredible outcomes in this building that wasn't even ADA compliant because it was a really old building. And was challenging. And so we had to make the difficult decision of pausing services.
Yeah. I remember when that happened and how difficult that was, not only for you, but like I know how much you value being a steward to the community.
Yeah, it was devastating.
Yeah.
And I remember meeting with our graduates from Thunderbird, right? And we still had, community recovery groups that met there. And what they said to me is, we get it. Yeah. Yes, we deserve a nicer building and we need to be able to expand. Yeah. We need to serve these populations that don't have access to service. And what we need you to do in the interim is open up IOPs, intensive outpatient programs. And so we did.
Yeah.
And so now it's completely full. Now we have to expand our IOP programs, and we are about to reopen our services. And so, it was a difficult decision, and it happened right before COVID. So sometimes creator speaks in interesting ways. And here we are with a new property on Vashon Island that is incredible.
So exciting.
So my board chair says, Betty Ford's going to want the Thunderbird of the recovery community.
Exactly.
It's going to be that beautiful.
Well, and what I've always thought in my experience working with Indigenous communities and Native and tribal communities is like I've always thought that is what should be imparted holistically in the recovery-centric idea of mainstream recovery, right?
Right. Yeah. I mean, I think that, centering everything we do on traditional Indian medicine, right? Building ceremony into our into West or having Western modalities work within ceremony.
Yeah.
Is the best possible chance for recovery. Yeah. Because, there's community incentive. And I'll have to tell you, for American Indian and Alaska Native people, it's interesting because you talk about folks in AA, right? Yeah. They say, you have to get sober for yourself, right? You only have, you have to place yourself first. You have to have enough value in yourself. That's not always the way our community works.
Sure.
They say that you can't get sober for your family or things like that. Sometimes our communities, our people, get sober for only that reason, right? We have been conditioned to devalue ourselves. And so, and also historical trauma comes from a collective group trauma experience, which means that you have to heal together. And so, so I think that centering everything we do on traditional Indian medicine, there are protocols associated with ceremony. There are protocols to being able to handle medicine. And those things help people stay sober.
That's amazing. I have like 3 follow-up questions going through my head, and I'm trying to prioritize which one I'm more excited to talk to you about. But the one that's winning out is one of the things that I've learned from folks like you and Derek and James at Chief Seattle Club, folks involved like with Cowlitz Tribe, our community members out in the Muckleshoots, Snoqualmie, like so many folks that I've had the honor and privilege of working with. One of the pieces of learning that's been most transformational for me is the idea that when we show up, we don't show up just for ourselves or by ourselves. We show up with 7 generations before us and for the next 7 generations. Can you talk a little bit maybe about that? Maybe do some education for me, maybe some community, and if I'm saying it wrong, please correct me, or how that idea about our elders and our future play a role when
Sure. Well, yeah, I think so. the concept is really grounded in that every decision we make impacts 7 generations forward. And then if you think about it from a healing perspective, right? Like let's define historical trauma for a moment. And this is from Dr. Maria Yellowhorse Braveheart's definition. It's a cumulative psychological wounding emanating from mass group trauma experiences over the lifespan across generations, right? And, I think this is something that you and I really connect on because, frankly, Dr. Braveheart identified this in studying the Jewish Holocaust, right? Is that for generations later, you're seeing these symptoms of trauma. Sometimes that comes in substance use, substance abuse, and sometimes it comes in the form of PTSD. Sometimes it comes in the form of diabetes, right? And so the idea of healing for these generations forward, right? Like breaking those cycles of trauma, but also healing those generations back.
Yeah.
I mean, there's nothing more powerful.
Yeah. You could see I'm visibly moved by it because you think about, for me, I think about even being here today, and we're not just showing up, but we're people who show up with histories. Right. And we're people who show up, representing community. Right. And we carry that forward. And so, thank you for that.
And I think that, if you think back like 15 years ago, don't make me emotional right away.
I know, I'm sorry.
That's okay.
We'll laugh.
I mean, think about it was all the rage about 15 years ago, right? Like implementing trauma-informed systems of care. Yeah. And that was really what you were just speaking to, is recognizing that we each come from our own experiences of trauma and we're committed to not re-traumatizing one another.
Yeah.
At the Seattle Indian Health Board, we have what we call our Indigenous knowledge-informed systems of care, or Indigino, people are calling it. And what that means is, sure, we recognize that we come from our experiences of trauma, and we commit to not re-traumatizing, and we also recognize that you and I are still sitting here.
Yeah.
And we're still sitting here because our communities have a strength.
Yeah.
Right? And that is the piece that is really key to our success.
Yeah.
Right?
And it's that resolve, right?
Yep.
Like we were talking a little bit before we started about like that warrior mentality, right? And like just being able to persevere through tough times for our future and in honor of those who have came before us,
And standing together in solidarity, right?
Yeah, absolutely.
To help one another out in those challenging times.
Yeah.
And I think that right now, that's exactly what we need to do.
Yeah, absolutely.
I think that, there is huge encouragement to pit ourselves against one another, to turn back to that scarcity mentality, to do the work of oppressive systems. And I just refuse that because we're sitting here.
Yeah.
And we know that at some point our ancestors did that for one another.
Yeah. To those out there in podcast land, sorry that this got emotional, but it's an emotional subject, right? And
it is.
And we think about, like, for me, even thinking about recovery and thinking about all those that we've lost to like substance use past, right? In the past, and my brother died of an overdose, as you know, and you think about all the other community members that we've lost. I think one of the things that's always really important for me to highlight is that, and when we think about, for me, it's also thinking about intergenerational trauma is our community members that are dying at the highest rate in our community is American Indian, Alaska Native individuals, our Indigenous community members who have had so much intergenerational harm caused upon them, and Black community members who have also suffered institutionalized racism top to bottom, and continued to be discriminated against. And so I think it's really important that we also have systems of care that are crafted by people, that like when a Native person comes to Seattle Indian Health Board and comes to a clinic, can you maybe talk a little bit about why it's important for them to connect with people who also have, and by this, I also just want to acknowledge that people who come from different tribes, there's differences in culture and stuff like that, but why it's important for people who are Native, Indigenous, American Indian, Alaska Native, to see people like them, and to
see our own faces, speak our own language.
Yeah.
I think before I say that, I'm not going to apologize for the emotion. And I don't want any of you to apologize for it either if you felt it. The reason is because the worst thing we can do is become desensitized to the impact.
Yeah.
Each one of us has been impacted by challenges with, either trauma or substance use.
Yeah.
And we need to keep that at the forefront because that's what will keep us driving with passion. That's sometimes we find our connection in spirit, and that's just what happened.
Yeah.
And so hopefully if you feel connected to us in that way too, then just drive that passion.
Yeah, exactly.
And back to your question, yes, Seattle Indian Health Board, we're not an environment where we're trying to create some weird like pan-Indigenous experience. We recognize through the impact of boarding schools where, our culture was purposefully stripped from our children, our languages were challenged. Our spiritual practices were actually illegal. When we think back to that history, sometimes all we can do is create an environment where that blood memory is sparked, right? Where you remember for a moment who you are. Where your language speaks to you and you don't know why.
Yeah.
So coming to the health board, some people come just to see other Native faces, to escape the racism that they experience, in the streets.
To be in community.
To remember who they are. I mean, one of the core components, I think it was Joseph Gahn who said that strengthening cultural identity is key, right? To recovery, to healing.
To healing, that connection, right?
Yeah, definitely. So you have to cultivate an environment that allows that to happen.
Yeah.
And that's what we do at the health board. So we have access to a network of traditional Indian healers, practitioners, and also, culture keepers, so that we can give access to as many diverse tribal communities as you possibly can get. And we're continuing to build on that network, as well as part of every single care team, you have a traditional Indian medicine apprentice who can do that kind of, if I think about it from a behavioral health perspective, like they do that prevention, early intervention work, right?
Yeah.
They might be able to do a prayer with you or give you a smudge or do a cultural assessment and then get you to the right practitioner to get you what you need. And that is key to our success.
Yeah.
People want to know, wow, how have you grown so much? Or why is everything you do, why is it so successful? And I say, well, first of all, our community is powerful.
Yeah.
We've learned from our community and all we're trying to do is educate this Western system to our cultural ways. And that's what it's all about. Yeah.
It makes me think a little bit about the power of traditional medicine.
Yep.
And one of one of the things that has amazed me about your work and the work at Seattle Indian Health Board is you also are pioneers in maybe not other ways, but you had one, I'm wearing my buprenorphine saves shirts, and you had one of the first low barrier buprenorphine clinics in the country, right? And bringing what I'll call sort of modern medicine, if you will, or for lack of better terms, and coupling that with the power of traditional healing and traditional medicine, to me that's amazing, right? And it's such bringing together ways for people to heal and be healthy. Do you want to talk a little bit about that work?
Yeah, I think that's very purposeful. I am so blessed to work with a team at Seattle Indian Health Board that is fearless.
Yeah.
I mean, we make data-informed decisions, but we do recognize the value of taking calculated risks.
Yeah.
And if the risk is, the benefit of the risk is improving the lives or the outcomes for our people, we're going to champion it.
Yeah.
And one of the things that we were talking about earlier, right, is having a vision or an idea, but truly having a plan of action connected to it,
totally.
right? And so we live kind of by that mantra that, if you have an idea without a plan, then it's just a dream.
Yeah.
So everything we do has a plan.
Yeah.
And we have expertise within our organization to be able to drive that forward, whether it's data expertise or clinic service delivery. And I will tell you that, it's in every sphere of influence within our organization that culture has been adopted.
Yeah.
And so, yes, I mean, we've built traditional Indian medicine. It's actually in our electronic health record system.
That's amazing.
That is incredible.
That's
We have
amazing.
an apprentice on every care team. Never been done. Even our dental teams are integrated.
Yeah.
So that, our relatives, we call our patients our relatives, are served in a way that every service comes to you, is available to you. Because that's what it's all about. It's for the love of Native people.
Yeah. And I also know that you do a lot of work on the national level.
Yes.
And one of the things that you were telling me that I had no idea about is that, and this is for like policy wonks too, is that Medicaid or Medicare 1 and 2 actually has now billing codes for traditional medicine. So there's even a pathway to adoption nationally, so that programs like yours can be compensated also for the healing work that's done.
Sure. Yeah. And I mean, I think that's a lot of work that we've had to do with community as well. I mean, one of the things that we really work towards is becoming less and less like grant dependent.
Yeah.
And so we know that we have to have sustainable systems.
Yeah.
So we've been working to get traditional Indian medicine to become a billable practice.
Yeah.
Recently, CMS did develop a code for traditional Indian medicine, and they approved 4 states to have traditional Indian medicine become a billable service. We recently worked with the state of Washington and the American Indian Health Commission, and it looks like there's a proviso moving forward that will allow that to be true here in the state of Washington as well.
Cool.
And we've been working with the Community Health Plan of Washington, right? Because managed care organizations have a role in this, who has agreed to pay for traditional medicine as a value-added benefit.
So amazing.
And so essentially, we looked at this, and we have 3 years worth of data now, and we've seen incredible outcomes, like significant reduction in suicidal ideation for folks who access traditional Indian medicine. And so recently we provided congressional testimony to point out that the cost savings that occur within health systems could be resolved with these tremendous outcomes with by just supporting traditional Indian medicine just a little bit. So I'm very hopeful that in the state of Washington this will happen soon. And yes, it goes back to being told you can't. And we pull together a team of folks who prove that indeed we can. And we try and we fail and we try again until we get it right.
I mean, I think one of the things I've learned in working with you over the past decade almost is there's nothing that I will ever say that you can't do. Like you and your friends and colleagues and community members at the health board, at Seattle Indian Health Board are just, the work you've done is just so transformational, So one of the other questions that I had that I was thinking about while you were talking about is so many of the people through the recovery community have probably been touched by Thunderbird and maybe have gone to Thunderbird and maybe didn't even realize what's to come for the new Thunderbird. So can you take a second and talk through what's to be I don't know, because I'm super excited about it. So and I think, and we've talked, and I know you're super excited about it. And I've been talking to you for years and heard about the vision, and I'm like, well, okay. I'm like, if anybody can do it, Esther can do it. But can you talk a little bit about what's coming to fruition and what's next?
Absolutely. We purchased a site on Vashon Island, and it was formerly a memory care center and assisted living facility. So there's a little renovation that needs to be done. Mostly we have to make sure that we have enough space to support the pregnant and parenting community, as well as making sure that it's an Indigenous experience.
Yeah.
It butts up against a land trust. It's about 2 miles from the water.
Oh, wow.
Our model is centered on traditional Indian medicine, and specifically for the pregnant and parenting piece, our program model is grounded in gardening. We've received incredible support from the Vashon community.
So great.
And I think about the folks from the land trust, right? And being able to do strong collaborations. It will be an experience like no other. We have our ceremonial space, a sports court. I mean, like I said, Betty Ford's going to want to be the Thunderbird of the recovery community.
I mean, it's so exciting. And, this is another million hours of conversation that I'm sure we'll have over time. But to think about providing that healing space for individuals who are pregnant, for individuals with small babies, and that ability to heal and to address substance use disorder, to find recovery, to have an opportunity to have that within grasp, and especially within Native traditional healing space. Can you talk about maybe why that was so important to include a Thunderbird?
It's incredibly important. We're losing generations of our community, to substance use challenges. And, so our kids are being adopted out, and there isn't an environment to keep families together. And so we wanted to take a step forward to make sure we met that need. And I'll just remind folks, Thunderbird is open to everyone.
Yeah.
And again, we serve all people in Native way. And for King County, it will increase the bed capacity by 62%.
Amazing.
So I will ask everyone out there to rise up and support us as we move forward.
Yeah.
We're just pending our permit. As soon as we get that, we'll be open within 6 months.
It's so important because, throughout time, there's one question I've been asked time and time again in my work and time here in King County. It's like, why don't we have more beds? Why don't we have more beds? Why? And so what you're saying is, by bringing on Thunderbird, we're going to almost like between 50% and double, like expanding the capacity, like a tremendous amount for people to find recovery, to find treatment, to find healing within our community.
Absolutely.
Oh, this is amazing and so exciting. So, unfortunately, our time is coming to an end here in this conversation. You're probably glad because I know you've had a long day and are excited
Right.
to get home and all of that type of stuff. And my indebted appreciation on behalf of King County Recovery Coalition and the Washington Recovery Alliance for your time here today and for spending that time with me and talking about the work that you've done and the work that Seattle and Health Board's done and is still doing to promote recovery. I guess one last question for you is, thinking about the recovery community, is there any last words or last thoughts that you have that you want to share? Thinking about, I don't know, anything. What's really important? What's top of mind? For you heading into the future and the importance of recovery and the recovery community and the recovery space.
Absolutely. I think the most important thing is that Seattle Indian Health Board is a truly community-driven model.
Yeah.
And I think for folks in the recovery community, remember to listen to our communities. Remember to recognize the value of cultural resilience. And to be able to support that in a meaningful way, not just through words, but through true action, meaning resources and support and understanding. And I think that that's really key. Thunderbird is coming to solve only one part of what the recovery community needs. It fills one of the gaps. Yeah. But we still have a lot of gaps related to detox, related to housing, and related to mental health challenges. And so, again, I'm just going to ask us all to stand together. Remember, it takes every single one of us standing in that circle for healing to happen. Yeah. So don't step out, even if it feels like there's pressure to.
Yeah. And the ability to stand strong and to advocate and to know that we have community, right? And to connect with community. And sometimes it gets hard and sometimes it gets challenging, but to know that there's community for people and that for people to be connected. Amazing.
Thank you so much, Brad. It's always an honor to just sit with you, but to do it, with kind of this public eye, you guys get to see how we roll, even when we're just having a cup of coffee together.
Yeah, so. This is the exact same conversation, right? And this is, and you're one of the very few people in my community. Well, that's not true. That's just me brown nosing a little bit, or just sucking up a little bit. But you're one of the many people in the community who just make me so proud to be part of this community. You are one of the few people that I fanboy over just because, the work you do, I just admire it so much. And, from the second I met you, a decade ago, when we were both relatively new to this community, I just am always inspired by you. And so you make me strive to be better and to do better. And so, always just deep appreciation for you, Esther, and the recovery community at large. Just such deep appreciation for you. Thank
Absolutely.
you. Yeah.
Just remember, our community's worth it.
Yeah. Our community's worth it, and every single person out there. There's pathways to recovery, and there's and that's what the work that you are doing makes me really excited about that. So thank you again for everything, and thank you for listening in today and sticking with us. Thank you for your work, and thank you for being part of the recovery community, and thank you for supporting the Washington Recovery Alliance and King County Recovery Coalition just by watching here today and being part of community. So thank you. Hope everyone has a good day.
Bye, everyone.